Ms. Richards, ladies and gentlemen, gentlemen of the press and ladies of the press, let me say a few words about our next witness, and let me put it in the context of anonymity. For very good reasons, some of those who would wish to give evidence orally, but also are concerned about their identity being known, may apply for anonymity. The inquiry has various measures to respect their wishes as far as it can. That's the case with our next witness, who will therefore be known as Mrs. A. There is a legal protection behind it, and let me just go through that with you, because the consequences of revealing her identity to anyone else outside this room or anyone are quite serious. I am making what the law permits me to make, which is a restriction order. This is known as an individual restriction order in the case of an individual, as the name suggests. And it is the case with witness W0140, which is the numerical version of Mrs. A. You'll understand why we don't use it in the hearing room. I order as follows: that the name and address of Mrs. A and any other identifying information, such as the witness's image or a description of their appearance, cannot be disclosed or published in any form unless express permission is first given by the chair of the inquiry or the solicitor to the inquiry acting on my behalf. She must be referred to only as Mrs. A. The order remains in force for the duration of the inquiry and at all times thereafter, unless otherwise ordered. I may choose to revoke or vary the order, but only by making a further order during the course of the inquiry. It would be a courtesy to her if those of you who have mobile phones, I noticed that one went off this morning, not a problem particularly, but those of you who have mobile phones, could you please turn them off, because they may give rise to a fear that those of you who have them might use them to take photographs. You won't, I'm sure, do it, but please, if you have got phones, just turn them off so that they aren't operative during the period of this witness's evidence. Thank you very much for that. Are we now, when she gives evidence, she will come into the room. She's chosen to do that. She's taken that brave step, but the cameras will not be on her. We have organized the visual imaging to concentrate purely, I suspect, on Ms. Richards. And no shot will be taken of her, either coming in to give evidence, leaving after her evidence, or during her evidence. Thank you very much. Ms. Richards.
So Mrs. A is here in the room, and if she would mind stepping forward and giving her evidence.
So for the purposes of today, your name is Mrs. A, but your full name is known to the inquiry. If you could please repeat after me with the book in your raised hand. I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
The evidence I shall give.
Shall be the truth.
The truth shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
You're a retired nurse.
Yes.
And you spend some time managing your husband's medical practice.
Yes.
And you suffer from a condition called von Willebrand disease.
Yes.
And I wonder if you could just tell us briefly what that is.
Yes, factor VIII-related antigen deficiency, which in its mild form that I've got usually gives no problem to me, but can be cyclical in nature, so therefore you could have quite a heavy fall and escape with no bruising whatsoever, and then at other occasions I could brush past a table and I'd end up with a haematoma on my leg. So it's quite unpredictable, but the condition that I have is quite mild.
And it was discovered in your case when you were a young adult, I think during routine dental surgery.
Yes, I had a tooth removed and it continued to ooze, didn't stop bleeding, and I had to be admitted to hospital and have it packed and sutured to stop it bleeding, which precipitated me having a blood clotting screen to see what did I have any blood clotting disorder, and that was when it was diagnosed.
And that was in the mid-1970s.
Yeah.
And the advice you were given, because your condition was classed as mild, was that you should be fine. You might bleed more than normal from time to time, and you should let medical and dental staff know
Yes.
on any future visit or medical intervention that you had von Willebrand disease.
Yes, but didn't require regular treatment.
So in April 1987, when you were pregnant with your first child, you were going to have a planned caesarean section because of preeclampsia.
Yes.
And can you tell us what happened at the hospital?
I was admitted to the hospital and I was informed that I would have cryoprecipitate. So I asked why was this the case, because were they expecting me to bleed? Because in pregnancy, usually our factor VIII levels physiologically are much higher, so your chances of bleeding are less. And I was told that it was a prophylactic measure that they were going to take, and I was going to have pre-op and also post-op for 3 subsequent days, cryoprecipitate, which I wasn't particularly happy with, but they more or less insisted in the end that I would have this treatment.
So it was the consultant, I think, who told you that you were going to be given
Yes.
prophylactic cryoprecipitate.
Yes.
And I appreciate you're from a nursing background. You're confident that what you were given was cryoprecipitate?
Yes.
Told you were going to have that, and you questioned it, I think.
Yes.
What did you say? Can you recall?
Well, I just wondered why I was giving it prophylactically and not it would be kept in reserve just in case there was a problem, because the surgeon was aware and he wasn't particularly worried, and he said he would just take extra care during the section of tying off vessels and not just cauterising them, and they would just take extra attention. And that I thought that perhaps if bleeding did occur, then they could give me cryoprecipitate as a response to a problem rather than just being given it prophylactically.
And you were given it, I think, on the first day by the consultant, and then on the 3 successive days by junior doctors.
Yes.
And on each occasion, did you raise any question about whether you really needed it?
Yes, because each time they would put a new Venflon in instead of flushing it and leaving it in for the next day. They would remove it, so I would think they then did blood and they would be testing my levels, and my levels were done and they were okay. So I presume that the following day I wouldn't need it, but each day a new batch would arrive and I would be given it again.
And you were told, I think, when you question it subsequently with the junior doctors, it was being given to you just in case.
In case, yes.
Did you feel that you were effectively given the opportunity to refuse to have it?
Not really, no. And I, with the level of knowledge I had at the time, I just presumed it had been heat treated, which I presumed most blood products were at that time. So it was just more of an inconvenience rather than a precipitated, an infection risk. I didn't think there was. That didn't enter in my head. It was just inconvenient to me to keep giving something that I didn't need.
So you assumed it had been heat treated.
Yes.
And you assumed it would be safe. That was because of your general nursing knowledge and background. Did the doctor, the consultant, or any of the junior doctors, or indeed anyone else, give you any information or advice about the potential risks
No.
or pros and cons of having it?
No, none.
Now, after you had the caesarean section, and after you gave birth, I think a few weeks later you woke up and something had happened. What was that?
My eyes were almost orange and my skin was yellow. I was obviously jaundiced. And so, because I was senior sister on a gastroenterology ward, and my consultant was the gastroenterologist with an interest in hepatic diseases, I went up to the ward and my husband accompanied me, and we had blood taken, and my liver function tests were grossly abnormal, and they took bloods for hepatitis screening, which at that time didn't exist for Hep C. If it wasn't A or B, they just called it non-A, non-B, and subsequently that came back as being positive, non-A, non-B.
And it was, you had, I think, as well as the blood tests, you had liver function tests and an ultrasound.
Yes.
And at a follow-up consultation, you were told that your liver was inflamed, virus of unknown origin, but you were actually told, I think, by the doctor that it was probably connected to the cryoprecipitate that
Yes.
you'd been given.
Yes.
Can you remember what, if any, advice you were given about the condition at the time?
Well, at that time, and I think the level of knowledge that people had was that probably once the acute illness subsided, there was a huge chance that I would just clear the virus naturally and would recover, which didn't happen.
Now, were you given any information about any potential risks of infecting others?
No, not at that stage, no.
But you were told that you would have to tell other medical professionals.
Yes.
And was that because of your own profession at the time?
It was, because I worked on a ward and I'd done lots of intensive care where there's lots of invasive procedures, and therefore, as most people were given advice at the time to wear gloves and be extra vigilant, but because of this, I removed myself from doing any invasive procedures just in case. And I did intend to return to intensive care, but because that involves hemofiltration and putting people on dialysis machines and actually needling those people, I never returned to that area of nursing again.
Now, the events we're talking about had been in 1987, and you were told it was non-A, non-B hepatitis. But some years later, in 1993, you were tested for what was then recognised as hepatitis C.
Yeah. In the subsequent 6 years, I had periods where I would develop abdominal pain, and I saw my consultant a number of occasions, and each time my liver function tests would be done, and they were still abnormal, not grossly abnormal, but they were still not normal. And my bilirubin would rise to about 40, and occasionally I was mildly jaundiced, so I intermittently would have ultrasounds, which just showed mild inflammation. I didn't have cirrhosis or any structural serious damage. So when the new test came out, the PCR test, which could detect hepatitis C, my consultant approached me and said, would I like to have it done? At that time, I'd just thought, well, why not? It will probably be negative, but at least I will know. And so I had it done. And as a consequence of having it done, it was suggested at the same time to have an HIV test, which was rather devastating at the time because I hadn't even gone down that avenue. I'd completely forgotten it because in the interim I'd had another baby who had severe learning difficulties and took up a lot of my time. So that was just put on the back burner. I never even thought of it. So it was a huge shock when it came back that it was positive. The HIV was negative, but the hepatitis C was positive.
And what was your reaction to that? Can you recall?
Quite devastated, a bit depressed, because the little bit of knowledge I had at the time was that it could be a death sentence, and it was like the sword of Damocles hanging over me, that, I could develop cirrhosis, hepatoma, liver failure, all of which were not an attractive proposition, and worrying that I may have given it my husband, or suddenly I just thought that, you know, I was a leper, because at that time there was no treatment.
And you say in your statement you were terrified until your husband was tested and came back negative that you'd somehow passed it on to your husband. You were terrified that your children had become or could have become infected. Because you were a nurse, you had a degree of knowledge about the condition and knew that it had the potential to be very serious indeed.
Yes.
And you just used the phrase leper. You had to tell employers, you had to tell medical professionals about your condition. And you've said in your statement that's how you felt. You felt like a leper. Is that right?
Yes. Because even though my colleagues were all medical professionals, there was still a degree of ignorance, and still is, about blood-borne viruses. And people just presume that your sexual and drug history must be, there must be some sexual or drug history, and you're always asked about it, even though you have an incident in your life that is quite obviously the cause of what is happening. People still run through the routine of having to ask you, which at the beginning you don't mind, but at the 95th time you've got to go through it is quite soul-destroying, and you end up becoming quite depressed about it and worthless. And I think I felt a lot less confident about myself. And actually, at that point, there was no treatment for it, and I actually removed myself from clinical nursing and became a teacher of resuscitation to nurses, doctors and other hospital staff, and I had no contact with patients at all.
And you suffered physical symptoms as well.
Yeah.
What were the worst elements of the physical symptoms?
Tiredness, immense tiredness, which I just put down to having 2 young children, but it was a lot worse than that. I still managed to work full time, but then at the end I would be absolutely poleaxed, and I would almost fall asleep driving home. I was exhausted, and on my days off I would try and sleep as much as possible, even if it was just during the day. If my husband was home and would look after the children, I was just tired all the time, aching, like I'd flu, really.
Now, in around 1995, you'd had another child at that point, and you were selected to take part in a clinical trial and research project for interferon in Edinburgh. What can you recall about the discussions that you had with your consultant and the circumstances in which the trial commenced?
Well, I arrived in Edinburgh pregnant, and the consultant obstetrician informed, because of the von Willebrand's disease, informed the haematology department, who then informed the hepatology department, and I went round the houses and saw everybody. And at the time, because of the high incidence of drug addicts in Edinburgh, I think that they had a particular interest in trialling interferon A, and so asked that when I had delivered the baby, would I be willing to go into the trial? And I, obviously, because there was no other treatment at the time, said yes, I would. And so I was entered into the trial of interferon A, which at the time wasn't an oral preparation, it was 3 times a week subcut injection.
And just before we talk a little about the interferon trial, whilst you were in hospital having had your newborn baby, you were put in a side ward, and you weren't allowed to have your newborn baby with you to ensure that you didn't have that she didn't contract hepatitis C, and you weren't allowed to breastfeed.
No, the delivery. I was originally on the beginning of the list. They were going to do me first, and then information filtered down that I was Hep C positive. So then I was put on the end of the list as a dirty case, and had to wait till everybody else had been in. And then at the end, I went down to theatre only to find I'd chosen to have an epidural so I could remain conscious. But in the end, when I went down to the theatre, I wish I'd chosen to have a general anaesthetic, because everybody was dressed up like a Martian, as well as you obviously expect masks, but people had heavy-duty masks on. They were double-gowned. They also had plastic aprons on, and they were wearing visors. And so it was just humiliating and very upsetting.
So the course of interferon, the trial, it was an 18-month course?
It was.
And you had to inject yourself 3 times a week?
Yes.
What can you recall about the side effects of that trial?
Awful. You just felt like you had flu constantly, aching, swollen joints, difficulty getting up and down stairs, difficulty walking. I had no option because I had a young baby, a young child, and also a severely handicapped child to look after. So I put down a lot of the tiredness to that, but it was in excess to that. It was just awful. I struggled really to remain on the trial, but the early stages of it, when I was being tested, it was working, so that was a huge incentive to stay on it, because if I could clear the virus, I just hoped that I would completely feel well again. And so therefore I did complete the 18 months.
And during that process, you've described in your statement, it took quite a toll on your family life, your ability to look after your children.
I was very depressed.
And on your mental health.
Yeah, because I'd only taken maternity leave. I was going to go back to work. I was unable to go back full-time, so I went back part-time nights and still managed to do it. But it required my parents coming to live with us for a short period of time, because taking the interferon and the children, it was just too much. And my choice of job had to change. I did coronary care instead of intensive care because that wasn't invasive. And of course I had to go through the rigmarole of telling my employers again.
What was the outcome of the treatment?
It was successful. After about 8 months, I think, I'd completely cleared the virus. But the team in Edinburgh thought to make sure I should complete the 18 months, and I did. Took their advice and I completed the 18 months.
Now, you've talked in your statement about how you were treated by others when you informed them of the infection. You give a particular example in relation to seeking dental treatment. What can you tell us about that?
Once I knew I was Hep C positive, as a responsible person, and when you fill in a questionnaire, of course, when you attend a dentist, you've always got to fill in, and you fill it in truthfully. So I had to fill in that I was Hep C positive, and I had more than one occasion where I was refused treatment because they said they didn't have the facilities for treating people with blood-borne viruses, and wouldn't take me on as a patient. So tended to have to go to hospital departments where they were used to dealing with people with blood-borne viruses.
But even having your dental care in the hospital, you describe it being very different from how you would have expected it to be in terms, again, of the precautions that were being taken.
Yes, because again, at that period, people were being extra safe, and so you were treated like a leper, always at the end, always separate instruments, always called the dirty instruments. They would be the instruments that would be saved for people with Hep C and AIDS. And this would always be made drawn to your attention that was what was happening. And of course, the ancillary staff would always come and have a look at you, the dirty patient at the end of the list, which is soul destroying.
And you've told us already about the experience when you gave birth to your third child in Edinburgh, and the way you put it in your witness statement is you felt like you were being treated like a plague victim. Now, you've tested negative for a number of years now.
Yes.
But I think it's right, you still get this response when you seek medical treatment, and I wondered if you could tell us a little about that.
Yeah,
please.
unfortunately. I was tested routinely, at first 6-monthly intervals, then 12-monthly intervals. And then when it got that I was 5 years down the line, still negative, the consultant haematologist told me that the research had shown that that would probably be indefinite. And therefore, I did not need to keep presenting and having being tested. Because, of course, simple things like applying for a mortgage and things like that always resulted in great difficulty for my husband and I. So very often I was missed off because it would just muddy the waters, and we'd have to have AIDS and hepatitis screening, and so I just remained off it. Sorry, I've forgotten the question.
You've described in your witness statement how you continue, even though you've been clear of the virus for many years, to still be treated by some medical professionals as if you still have the virus.
Yes, exactly. Recently, and it depends which hospital you go in and what policies and procedures you have, I've recently been in hospital because I had breast cancer and had a mastectomy and a reconstruction. No problem whatsoever with that hospital because everyone is treated the same. And therefore, I was not treated as a dirty patient. I was not shoved at the end of the list, and it was hugely relieving. It was very good. But then you can go to another hospital whose policies and procedures are completely different, and even if you're negative, you are still guilty until proven innocent. So I'll be asked to have another test. I don't mind now, but I do feel that if I am a risk and I've got numerous negatives in my notes, why aren't they asking everybody who comes through the door? Because I'm probably the only person that day who can show them a line of negative results, whereas they have no idea about other people's statuses. And that occurred recently when, at the age of 60, you're called for, where I live, a routine colonoscopy for screening for bowel cancer. And I was routinely asked to go for that. And, of course, you've got to go for a pre-procedure consultation. So I went for this with the specialist nurse and was told in no uncertain terms that I had been given my time and date, and the consultation was just routine. But she actually changed the date and the time because she said, I noticed you've been Hep C. Well, yeah, I'm negative now. Oh, well, you'll have to have it done again. You'll have to go at the end of the list and we'll have to use the dirty scope. At which point I just had it and I just said, why is this happening? Is everybody on the list? There were 6 people on the list. Are they all being tested for Hep C? No. Well, why am I being tested for Hep C? At that stage, I'd been negative for 23 years, and I must have had at least 23 tests saying I'm negative for Hep C, I'm negative for HIV. Why am I having it done? In the end, I capitulated and I had it done. And yet again, there was another negative, no apology, nothing, and ended up, didn't have to have the dirty scope. So, whoopee.
You, what in general terms has been the impact of, first of all, the infection itself and then the treatment on your family life, your social life?
I think over the course of the years, I had periods of depression which required treatment. So therefore, I can't say what I would have been like had I not been depressed, but the treatment for depression wasn't particularly pleasant, nor was having a depression pleasant. And that, on top of having hepatitis and the treatment interferon, obviously impacted on my ability to pursue my career. And I think in the end, I more or less gave up on my career. During the interferon, I went back to work to just part-time, so I finished my, you had to go back for a certain length of time for the maternity leave, or you had to pay the money back and all the rest of it. So I managed to complete that. But because I was still in the middle at that point of interferon, I could not return to work full time, and therefore enrolled and was accepted to do with the University of London to do an extramural law course. And I got all the material and started, but I had to disband it because I had this huge brain fog, tiredness, and I just couldn't do it. So I gave that up as well. Never given anything up in my life. And it started a chain of events where I started not believing in myself, just thought that things were unattainable, and so I wouldn't pursue things anymore. So a complete change in personality. I'd been very confident and would give lectures and go in front of a lecture theatre of maybe 150 people. Wouldn't be able to do that now. Completely changed.
And you'd had a particular concern and worry because one of your children also has von Willebrand disease,
Yes.
same genotype. And you've been worried that they could be given cryoprecipitate and be infected themselves.
Yes.
And you, to the extent that you put yourself on a particular medical trial to try
Yes.
and address that. What was that?
Well, he was diagnosed when he was quite small. He was about 2. And by this stage, I'd had the hepatitis, and I was quite adamant that I knew I'd had non-A, non-B. I didn't know at that time I had C. But I was adamant that he was not having it, and I was not risking it. And so I went to a children's hospital where they were doing some research, and I said, if he has it quite mild like I did, but if he, for instance, were to have an operation, is there any other treatment? And they said, yes, you could have DDAVP, which was IV. And how would I realise that that would work in his genotype? And they said, well, it's exactly the same genotype that you have. So if you have the trial, we could almost 100% be confident that it would work for him. And so I put myself forward for the trial and was admitted and had a series of infusions with lots of blood tests, and it did work. And so subsequently, when he was small and he went to school, he always had a card. And so the school would know that utterly and absolutely we refused for him to have blood products because we knew that the DDAVP would work. And subsequently I had that myself, and I've had numerous operations just under DDAVP, and an operation recently where I had nothing whatsoever and nothing happened.
And you've told us about how you had to tell employers, medical professionals, and the impact that had on what had been your work ambitions. You, I think, had support, obviously, from your immediate family and close friends, but you felt you couldn't tell your extended family.
No.
And that was because of the fear of stigma?
Well, also in the complete ignorance, really, of if there was ignorance in the medical profession, which I'd found quite a lot of, it wasn't unusual to expect that the general population would be equally ignorant, and people start extrapolating and obviously try to protect themselves and the children. And I didn't want people keeping me at arm's length, because people start thinking you can get it from hugging, kissing, shaking hands, touching the same light switch. I've seen nurses pushing meals into people with Hep C with a window pole because they thought they'd get it from just handing a tray to people. And you think, well, if medical people are doing that, what on earth are the general population going to be like? And so I just didn't tell people.
And then very finally, in terms of the questions I wanted to ask you, Mrs. A, you made an application to the Skipton Fund, and you found it, I think, a straightforward process, and you received some assistance in return. But you, for many years, had no knowledge whatsoever that the Skipton Fund existed. Is that right?
No, it was brought to my knowledge by the consultant haematologist who asked me why I hadn't heard of it and sort of put my name forward and filled some forms in for me.
And that was sometime in the 2000s?
It was, yes.
Okay, thank you. Those are the questions I've got for you, Mrs. A. Sir?
I have none. It remains for me to thank you very much indeed, Mrs. A, for coming to give your evidence, and to your supporter for supporting you.
Thank you.
Thank you. It would be convenient, I think, to take a short break.
Yes.
Shall we say 20 minutes? That should give people long enough to get a cup of tea or just stretch their legs. Then we'll have our third and final witness of the day.
Thank you, sir.
Now, Ms. Richards, I understand the next witness would like to be known as Lesley.
That's right, sir.
Well, would Lesley like to come forward, please, to give evidence?
Please state your full name
Lesley Brownless.
and repeat after me. I do solemnly, sincerely,
I do solemnly, sincerely,
and truly declare and affirm
and truly declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Lesley, you've got von Willebrand's disease.
I have, yes.
And you've described that very vividly in your statement. It means your blood clots, but the clot doesn't stick to the wound. Von Willebrand factors, a bit like the glue that helps the clot form a plug over a wound, similar to having mild haemophilia.
Yes.
And you've got mild von Willebrand's
Yes, I
disease.
have.
And that was diagnosed when you were a child.
Yes.
You've had blood products whilst under the care of the Newcastle Royal Victoria Infirmary in the early 70s.
Yeah,
And then Leeds St James University Hospital from 1975 onwards.
that's correct.
And when generally would the any kind of blood product treatment be given to you, and for what reason?
Early doors, it was mainly when I had perhaps a nosebleed that was quite heavy, or if there was some kind of minor surgery, a tooth extraction. It was all sort of given in case, just to protect me as a cover. However, later they did start to give me DDAVP, but that stopped working. And I have had surgeries since without, because they thought the DDAVP was working and without any problems at all. So I think that kind of shows the mildness of the von Willebrand's disease.
And if we can look at an extract from your records. Well, it's 11110002. And that should come up on the screen in front of you, Lesley. We can turn it round so it's landscape. And could we go to the second page? No, I'm sorry, there is only one page. My apologies. So we can see from this, Lesley, we've got, picking it up from 1982, we see
Yes.
references there to cryoprecipitate.
Yeah,
And then 1986 Leeds Factor 8 BPL.
yeah,
1986 Leeds Factorate.
yeah.
It's the Armour product. You don't think this is a complete record, do you?
No. There's things not on there that I know I've had in the past.
And you recall getting the cryoprecipitate, but you recall it being different from
Yes.
the factor products you subsequently had. What was the difference
Yeah.
from your perspective?
I always seem to remember the cryo was very cold, and it was administered via a drip. In fact, many times if I'd had nosebleeds and I'd had to go into hospital just for some treatment, the nosebleed may well have stopped by the time I got there, but they still carried on and gave me the treatment, because normally we'd a phone call in advance that would thaw it out, so it wasn't as cold when we got there. There was often a second bag as well that went in, which was to I don't know, stop it feeling so cold or something to that effect, they used to say. So that was how I remember cryoprecipitate. At some point in 1985, I believe, and I do think it's somewhere in my records, but it's not on here, I attended Leeds A&E department with what was probably a stiff neck or a pulled muscle. It was quite painful. Didn't seem to want to go. So they treated it as an internal bleed, which is something I didn't really suffer from. And the the product they brought to give me was in a very large syringe. And the lady, like I say, it was in 1985, so I'd only just started hearing about HIV at that point. And when the lady went to give me it, I said to her, quite naively, I hope there's no AIDS in that. And she says, no, it's all heat treated now. And it was totally different. It was quite warm when it went in. And within, I'd say, maybe 20 minutes of that being administered, I came out in blisters all over. And they kept me in, admitted me that night, assured me that it was a one-off, it wouldn't happen again. And I had to return the following evening, and they gave me some more, and it happened again, although not as bad as it had the night previous. And they just said, all it means is, from now on, we have to give you a more purified version. I didn't know what that meant, but that's what they said. And probably from that day on, I have got an itch that I've always described as not a skin itch as such, but it's coming from inside of me. And from that day on, within a few months, I was started on antihistamines, which I take to this day, and I've taken all those years. And I do believe that's where it came from.
So we'll talk about your diagnosis in a while, but you think that the infection that you got with hepatitis C was in consequence of the factor products that were administered to you on that hospital visit
Yes.
in 1985.
Yes.
And you think you've got some haematology records.
I have got haematology records,
You're going to
yes.
check them, aren't you?
Yes.
And see whether you can come up with a specific date
Yes.
for us. Your mum did a statement which you've exhibited to your witness statement. I don't need to bring it up on screen, Paul, but she says in that, her name's Dorothy Ryan, and she says in that whilst you were a child, she was never given any advice on any potential risks involved in receiving any kind of blood or factor product treatment. When you turned 18, when you became an adult, do you recall whether any advice or warnings were given to you on any of the occasions when you received factor products?
Never.
Now, you were diagnosed with hepatitis C when?
I've always thought it was 1995. Going back over some more records, that's possibly 94. That was the first time I got told. I was never brought in by the haemophilia centre or anything to, even though I was on the radar, they never contacted me. In fact, I had been visiting the clinic and nobody had told me anything about hepatitis C. I'd never heard of it. And it was only through bulletins I used to get from the Haemophilia Society that sort of had something on the front saying that I think it might have been 90 or 95% of people treated with blood products will have probably got hepatitis C. And it was on that information that I contacted my haemophilia centre and asked could I go in and see them.
And you saw a consultant haematologist.
Yes.
Who told you that you were hepatitis C positive.
Yes.
What information were you given and what impression were you given of the seriousness of the condition?
It was really flippant. It was just like, yes, it's positive, and that was more or less it. And of course, I was quite concerned, but isn't this bad? And that kind of attitude. And he just says, all of my patients have got it, and it was a case of just go away and get on with your life. We'll monitor your blood and we'll keep a check on it, but it was nothing to worry about. That was the impression I was given.
And you've said in your statement you were made to feel a nuisance.
Eventually, yes. Eventually I was, because there was very little information out there and I was given none, really, by them. And the information that I found myself was quite scary. It was full of statistics of 20% will go on to get this and 20% will die. So it was quite scary, really. And I suppose at that time I had 3 young children, so it was even more frightening because I'm thinking, if I die, what's going to happen to them? It was really worrying. So I did what I could to find out what I could. And of course, I went back and I'm saying, and bearing in mind I had been quite poorly for a number of years, and I was then becoming aware that the problems I'd been having were the same problems that other people with this were having. So I went back to him and I'd say, well, I've got this, I've got that. And I was felt, he made me feel that I was being a nuisance. And he said to me, do you want to go on treatment? Well, I'd seen some scary stuff about that. So I said, well, do I need it? No, I don't really want to. Okay, then he said, we'll give you a liver biopsy. And I was sent home to think about it, and I went back and I said, I don't want a liver biopsy, because I know it can be dangerous for haemophiliacs. That's what I'd read. He says, well, do you want to go on treatment? I says, do I need it? He says, well, no, but, it appears that, you're not going to be happy until we give you something. And it was at that point that I lost all confidence in him as a haematologist. And for the next few years, I didn't attend very often. In fact, I had the haemophilia nurses ring in and saying, you need to come in. You really need to come in. But it did put me off going because I had no faith. And from then on, when I did go in, I'd just tell him I was fine.
And you've described it as a dark time.
It was a very dark time, very.
And why was that?
Because I had the 3 children, small. I wasn't with the father any longer. They were my responsibility, I was there to bring them up and give them a good life, and that didn't appear to be what was going to happen. It was not knowing, and I'm one of these people, I need to get things straight in my head, and I can't settle until I do, but the information just wasn't out there for me.
And you've said in your statement you feel you should have been given more information, you should have been kept informed, you should have been offered counselling to help you deal with what you felt was a bombshell.
Absolutely.
And that you weren't offered any help or assistance at all.
No, I think counselling could have made a big difference to sort of making you realise you're not just alone. I ended up, because I didn't know anybody else, I wasn't a regular at the haemophilia centre, so I didn't know other people in the same situation. I ended up having a pen pal in Malta who had Hep C. I don't know where she got it from, but that was my only sort of contact at that time.
And you did go and see your GP, but your GP said you effectively knew more about it than they did.
He did, yeah, he did. They said that on several occasions.
Now, you obviously were aware you were being tested for hepatitis C because you'd actually initiated that process. Yes. If we could just look in your records, please, at 111100006, please, Paul. We can see here documents which show or appear to show, and your understanding is, testing for HIV.
Yes.
Were you aware that you were being tested for HIV
Never.
at any time?
No.
And were you told that you had been tested and were negative?
No. Not at this point, anyway.
And how was it that you eventually found out that you'd been tested for HIV and that you were HIV negative?
This was 1985, I see that they did tests, but in 2008, when I was about to start treatment, I went in to see my consultant, and he asked me my HIV status, and I said, well, I have no idea. And so he flicked through my records and he said, oh yes, negative. And that was the first time I was ever aware that I'd been tested.
And then if we look, please, Paul, at 1110005, you'll see there vCJD data. I think the handwriting is yours, is that right?
It is, yes.
But if we look across the top, we can see there, at risk, yes, patient notified, no. Assessed date, 21st of February 2005. So were you told at any point that you had been assessed at risk of vCJD?
I never got told anything with regard to tests or any data like that, but I did get a letter through the post from the haemophilia centre. Sort of what everybody else I think got was quite a lengthy letter explaining that we're all classed as at risk because we've had blood products. But, you know, you don't know how at risk. You don't know if you've had that batch number or not. So again, there was another worrying consequence, you know. And just prior to that, I had my daughter they'd asked my daughter, asked me if I'd allow them to give my daughter a blood transfusion, and I'd refused. And they'd told me, they'd tried to assure me that blood was, it's all safe now. And I had said, but you don't know what's around the corner. And unless my daughter is on death's door, I won't allow you to give her a blood transfusion. And not long after, I received a letter about the variant vCJD, so I was quite happy. And my daughter was never on death's door, and our blood recovered, you know, on its own. So that's why, you know, I always think there's always possibly something around the corner.
Now, can you tell us about the physical effects, first of all, of having hepatitis C?
As I said earlier, I had the effects before I knew I had it, and I didn't know what it was. So visiting your GP, again, you feel like they think you're a hypochondriac because you go in there with no reasons for these. The pain, the fatigue, as other people have said, it's debilitating. And the joint pain, the mental, the sort of brain fog. For me, I always describe it as like I'm running on batteries and the good head. Even to move your mouth to talk is an effort when you hit that sort of point. So it was more about pain, joint pain, fatigue, not wanting to do anything, you know, and of course depression comes in as well, which I think if you're depressed on top of the physical symptoms, it does make it worse as well.
You've said in your statement, you've described the mental and physical effects of the infection as devastating. Spent almost 30 years of your life on antidepressants and painkillers. Yes. Not being able to get up in the morning, not being able to go to work, not being able to provide for your family. You have had debilitating fatigue and pain.
Yes.
What impact did it have on your family life generally?
Well, for me, it was more me, because I felt guilty because I couldn't give the children what I thought they should have. To the children, it was probably normal because it's all they ever knew. You know, I had this when they were born, but mentally it affects you because you know what you were about. I mean, I didn't want to have benefits. I wanted to be self-sufficient and provide for my children. That was very important to me. I had a good career, which was gone. You know, so it impacted on me more so. It impacted on my mother quite a lot because she had to pick up the slack and look after the children a lot. She had to go part-time to be able to do that. So, you know, massively from my point of view.
You'd had a promising career as an entertainer, singing.
Yes, I was a professional singer, yes.
And you had to give that up due to the pain and the fatigue and the depression.
Yeah.
And you'd had a desire to study law.
Yes, I did. I thought I always wanted to. People did tell me that I had a flair for it, and it's something I wanted to do. And I thought once I get the children into full-time school, that would be something I would have liked to have followed, but it never came.
And that had an inevitable impact, your inability to work, on finances and on what you were able to do for your children.
Yeah.
You've had a number of other health consequences associated with the hepatitis C, I think. Fibromyalgia, what can you tell us about that?
Yes, I was actually diagnosed with fibro. I think it was after the hepatitis C. Yes, it was after I was diagnosed with that, which again is another debilitating illness that I believe it is knowledgeable that it is connected, and many people with hepatitis C do suffer from that. So, you know, whether or not I would have had it anyway, I don't know, but I do see there's a big connection. And again, like, there's a lot of like overlapping symptoms of hepatitis C, fibromyalgia, so it's hard to define which one is which. Although I do believe the fibro was caused by the hepatitis C.
And you've also had cancer and precancerous
Yeah.
cells found.
Yeah.
And you have at least a suspicion, I think, that those may have been associated with the infection.
There's evidence out there to show that people with hep C have a higher chance of developing cancer, any type of cancer. Obviously, liver cancer is more, notable, but yeah, I do believe that.
And you, the form of cancer that you had was thyroid cancer.
Yeah.
You eventually went through a year of treatment in 2008, 2009.
Yeah.
What was the treatment like?
Not very pleasant. It's like, every Monday night I would inject, knowing that I was going to, within a couple of hours I was going to be full of flu, or that's how it felt. You couldn't make any plans ever during that treatment, not plans that you thought, you knew you were going to be able to stick to. Wasn't very nice at all, wasn't pleasant for the children. But it was at that point that I told the children, because they were a little bit older by then, but prior to that, it had been hidden from them. I didn't want them to be involved in anybody saying anything, because we did have... there was an episode with a neighbour of mine that knew the children had bleeding disorders, and knew I had, so presumed I'd got HIV, and decided to shout it out to the street one day in anger, which was quite awful. So it was a way of protecting the children. I didn't tell them until, they were old enough, and just prior to me going on treatment. But it was a horrible, horrible time. And looking back now, I went on treatment with a promise that if I cured, as they say, I would be okay. And that never happened.
Did you clear the virus with the treatment, or do you not know?
I do know, but I don't think I cleared it. That's the word they choose to use. But I think I would like to say the virus is undetectable with today's tests. In the future, it may well be detected. When they get finer tests, they may be able to detect again. But I don't think it's cleared. I don't think it's gone.
And the symptoms themselves, as I understand your statement, haven't gone?
No.
So your statement says, in terms, I felt worse than before I started the treatment and still do to this day.
Yes.
The infection and the treatment and all the consequences you've described also took its toll on your relationships.
Yes. Yeah.
You'd recently married, I think, in 2007?
Yeah.
And with a childhood sweetheart who
That's
came
right.
over from Canada, and
Yeah.
you married.
Yeah.
And then you began treatment a few months later.
Yeah.
And what happened?
Well, he came over to England earlier than we planned for, because I was going to start treatment. And I just think the person that he thought I was, I wasn't that person on treatment. And things just went pear-shaped quite quickly. And I suppose we thought, well, this is a big mistake, what we've done. Without the treatment, I don't think it'd been like that, because I'm quite a laid-back person. And so he returned to Canada, and I never saw him again. With hindsight, I'm quite happy about that. But
You
for that
had
reason.
you had from the treatment mood swings, your hair fell out, unbearable pain, your
Yeah.
skin and nails and teeth were all affected.
Yeah.
You had problems sleeping.
Yes. I did consider stopping treatment at some point because my hair was falling out, and everything felt so sore and just didn't feel right. And I did have to reduce the treatment a couple of times due to I think it was the white blood cells dropping too low or something. And I did consider, but my haemophilia nurse taught me into continuing, and I did it for the year. Wasn't nice.
Were you ever offered any counselling?
No, never.
Do you think that would have been helpful?
Absolutely. At the time it would. I don't think it would now, because, you know, everything's already deeply embedded, you know, and it was at the time that I needed it. It wouldn't change anything now. It wouldn't change how I felt then, if that makes sense.
Can I ask you about the financial assistance that you sought from the Skipton Fund and Caxton?
Yeah.
So you got an initial Skipton Fund payment, and that was used for paying off debts.
I actually took my children on holiday
and
with
you
it
took the
the
children
first
on holiday.
time abroad, yeah.
But you said it was marred by the realisation that that would probably be it. You wouldn't be able
That's
to
right.
afford any other holiday.
Yeah, it wasn't going to be something I could continue.
And then the Caxton Fund, sometime 2011 or after 2011,
Yeah.
you were allowed some help from the Caxton Fund towards some furniture and repairs.
Yeah.
And some debt clearance.
Yeah, well, they actually asked me if they could come out to my house and visit me, and which at first I was a bit reluctant, because I thought they're coming to spy on me and see what I've got and what I haven't got, because you sort of develop this type of mistrust. But they came out and they were really quite good, and they came with a bit of a checklist that they weren't just going to ask me what it was I needed. They were going to say, well, you couldn't have this, you can't have that. And initially they were very, very good. And at that time, I'd run up a little bit of credit card debt, putting my twins through college, because at the 2010 review, we were sort of hoping that there might be some changes in payments, and I'm thinking, well, I'll get them through college, there may be something then, I'll be able to pay it off. So I'd run up a little bit, it wasn't much, so I asked them if they would help me with that. They agreed that they would, and I had to give them the details. And then they said to me, what we want you to do, we want you to contact these 2 credit card companies, and we want you to ask them to reduce the amount you owe them. And I said, I'm not doing that. I said, I've never had bad credit in my life, and I don't intend to start now. I've never missed a payment. And they said, well, you know, that's the only way we would do it, if you could try and get a reduced amount. So they agreed to do it for me, and contact them. And I think it was probably almost a year later, they were still trying to do it, by which time I'd run up more, because I was having to pay that and off the money I was due to live on and sort of spend more. So when the time finally arrived that they did pay it, they paid the original amount, but I was obviously still had more to pay back. So I was back in the same situation. And I also found that they were paying on this system of vouchers. They were ace. £10 vouchers, you know, and so I needed a washing machine. So I got 30 vouchers to go to Curry's with. And, you know, you've got to stand there and count these vouchers out. It's
How did
really...
that make you feel?
Oh, it's just so embarrassed.
You cried afterwards, you've said.
Oh, God,
Because
yes.
you felt it was degrading.
It was very degrading. And then I needed a bit of repair work done in the house. And you've got to get quotes, obviously, from different tradesmen. But when those tradesmen are coming to do the work, you've got to say, they've got to be aware that you're not going to pay them on the day. They've got to wait for a cheque once they've given you an invoice. So when the cheque comes, it's got Caxton Foundation on it. And it's not hard to find out what is wrong with me, you know. And I found that embarrassing to the point where I did take it up with them, and eventually they agreed that if you could get somebody to pay for it for you, they would reimburse it, but only after they had agreed it.
And one of the problems you've described is that the difficulties of the application process itself, and all the documents you had to get and the quotes and all the rest of it, is something you were having to do when you have the brain fog and the fatigue that you described.
I mean, I once applied for what they call a clothing grant for me and the children. And you've got to get 2 quotes for everything. So it would be, if you can imagine, 6 pairs of socks for that child, 6 for that, 2 quotes for them, 2 quotes for them, 2, every single item, 2 quotes. And then they'll only give you a set amount anyway, so it doesn't matter what those quotes are. They will give you, it was £250, I believe, per person. They will give you it then, no matter what it came to, what you asked for. Even if you ask for less, they'd still give you the 250 probably. And then you've got to give all the receipts. So you have to go out and shop for it all. Now, had they allowed you the money in advance, you could have bought it online. A lot of people were poorly, and it's difficult to go out there and shop for these things, you know, when you're not feeling up to it. So the whole system, it was horrendous, you know, and I believe many people just didn't apply because of it, and that's how it became for me in the end.
You once, with I think with some others in a similar position to yourself, went to Alliance House in London, where a number of the trusts and schemes were based, at the invitation of Mr. Harvey.
Yes.
How were you made to feel on that occasion?
We had a meeting at some point with Mr. Harvey in Coventry, and he had said we were welcome to drop in at any time. I believe at this point Mr. Harvey was on sick leave, and there was a new somebody else taking over. And we called in. We were down at other meetings, and we called in because I'd never seen what it looked like, and some other members had. And when we got in, it was because somebody had sort of like opened a door and sort of guided us along. They were astounded that we were there, and they just all stopped and looked at us as if we were, you know, what are you doing here? And it transpired later that they were going to call the police, that we'd sort of like bombarded their offices. And I mean, one of us was in a wheel, not me, but one of them was in a wheelchair. We were older people, you know, we'd been invited by Mr. Harvey to do that. And it did get really quite nasty with the threat of solicitors and things.
And you said in your statement you were mortified that they would stoop to these levels to the very people they were paid to help.
Absolutely.
Lesley, in 2001, you wrote a letter to the then Prime Minister, Mr. Blair, which sought to summarise your situation and the effect of the hepatitis C and everything else upon you. Do you want me to read it out, or would you like to read it out?
I'm happy for you to.
You want me to? Okay. Could we have it up on screen, please? It's 11110007. Dear Mr. Blair, I am a 39-year-old mother of 3 children, and I have hepatitis C. When I was diagnosed with hepatitis C in 1994, I was absolutely horrified. What was this disease? What will happen to me? Will I get ill? Will I die? Who will look after my children? They were just some of the questions flying around in my head, and the worst thing was, I had no one to give me answers, no one to talk to that knew very much about it. Counselling would have been welcomed with open arms at this point in time. My consultant told me the news, and I was just expected to go away and get on with my life. Over the next few years, I read as much as I could to find on the subject, spoke to as many people as I could who had the slightest bit of information, and discovered that ailments I had suffered over the years were actually symptoms of the hepatitis C, the following being some of which I suffer on a regular basis: severe fatigue, total lack of energy, even an effort to talk, nausea, joint pains, depression, itching all over body all day, every day, mood swings, problems concentrating, loss of appetite, sore throat, swollen glands, general feelings of ill health, and other things I would rather not mention. On top of all these symptoms are various other factors that have had a major impact on mine and my children's lives. I am unable to work, which is a great financial loss to the whole family. We don't get to go on holiday, have treats and the little extras that most people take for granted. And above all, that my dignity has been taken away from me, as I would want nothing more than to be able to hold down a job and provide for my family the way I had planned. I cannot plan ahead, as I never know from one day to the next how I'm going to feel. Consequently, my social life is pretty non-existent. My children say to me when I am ill in bed, "Why can't you be like a normal mum? Why do you have to be in bed so much?" That breaks my heart. I was a single mum as I split up with my partner due to stress and pressure we were under due to the hepatitis C. At this point, I was faced with another set of problems. Would anyone want me? If so, do I tell them straight away or do I wait? would they be frightened off? And the sad truth was some people were. So not only was I suffering all the stress and anxiety and worrying about the future, but I had to face it alone. This is just a brief account of the effects the hepatitis C virus has had on my life. It would take hours to explain the impact it has had on me and my family also. I hope you can find it in you to listen to what we, the haemophilia community, are saying and compensate us accordingly for the pain and suffering we've had to endure through no fault of our own. And secondly, to allow us all the use of recombinant factors so that we can be spared the pain and worry of any other virus that is lurking around the corner. And last but not least, let us have a public inquiry to find out why this was allowed to happen in the first place. Then perhaps lessons will be learnt to avoid this happening again. I would appreciate it if you could reply to me giving your views. I look forward to hearing from you in the very near future. Did you ever get a reply, Lesley?
No.
Is there anything else you'd like to say?
Yes, I've written a little bit, but it's because of this being so short notice, I needed to write it down, if that's okay. But first of all, I'd just like to say that I personally welcome this inquiry with open arms, and I intend to engage with it thoroughly whenever possible. One of the biggest impacts that's on me over the last 25 years, aside from my health, is the fact that I haven't been able to give my children the life that I thought they deserved, and not being able to work and provide for them and give them some of the nicer things in life that they would have had this not happened to me. Not being able to spend quality time with them, playing with them when they were younger, due to the constant pain and fatigue, and to this day it haunts me. I have 3 children and 3 grandchildren. All but one have inherited the von Willebrand's disease from me, because we don't know, it didn't come from anywhere previously. And it terrifies me that maybe there's more deadly viruses out there that may come along in the future and affect them. And it's for this reason that I personally have campaigned for years, along with many others, to get where we are today. And my legacy to my children and my grandchildren will be to finally get justice and the truth, and most importantly, that lessons are learned so this is never allowed to happen again.
Thank you, Lesley. I'm just going to turn my back and ask Ms Gibbs, who, as you know, represents you, if there's anything to add. Yes, there's just one matter that Ms Gibbs raised. We looked previously at the HIV tests, and you've confirmed you were unaware that you were being tested. Yes. And you've said in your statement that you think that that was possibly being used for research. The blood sample was stored and used for research because you were unaware of any other purpose for which it would be done.
Yes.
Thank you.
Well, thank you very much indeed, Lesley. And as you say, this was at short notice, so you are deserving of particular thanks for coming and giving us the benefit of your evidence.
Okay,
thank you.
Thank you.
Well, that concludes the business for today. I'm told there is some tea available, but just on this floor, should anyone wish to have it as they leave. What have we got tomorrow?
We have 3 witnesses tomorrow, Sir. Matthew Johnson, Jacqueline Britton and Joan Edgington.
Thank you very much. It'll be 10 o'clock tomorrow, so that anyone who is making plans for next week may be alerted in advance. Next week, we plan to start in the morning at 10:30. It may give people a little more time to get here in the morning. It may help with travel arrangements.